Okay, so Holmes, let's move to the next question, which is a tragic one, I would say, for the hospitality and cruise industry. How was the experience with COVID-19? Because industry shut down, how did you manage?
It's devastating. Absolutely devastating. It, we always thought in the cruise industry we were resilient and we were robust. We were getting through recessions without a problem. We thought we were untouchable, and how wrong we were, because COVID absolutely devastated the cruise industry. And if I give you a frame of to understand the trajectory of things, because we're only just getting fully over it, to be honest. 2020 we frame as the year of crisis. That's when the crisis happened in March.
True.
And we weren't ready for it. Nobody could see it coming. Although I was consulting the Vanilla Islands and I made a SWOT analysis and I put risk number 6, potential global pandemic.
Oh, you did that?
Yeah.
How did you know?
In 2019. No, because I didn't predict it. I said on the SWOT analysis it was a risk that could happen to the cruise industry. There were 10 risks.
True.
And I had to predict all the potential risks. And because I did that exercise, I came out with a global pandemic. But of course, when it happened, then, I never expected it to happen. Even though I had stated it as one of the risks. But when it did happen, I was possibly the least surprised, because everyone else was totally gobsmacked, didn't know where it came from, left field. But I had predicted that potential outcome just as a potential outcome. Now, so 2020 was the year of crisis. 2021 was the year of restart.
Yeah.
Just restarting at a loss.
At a loss.
No cruise line made money in 2021. They all lost. But they just had to restart to build confidence, on cruising again. Many of them had to do all sorts of things with their share and their capital to refinance, to, find ways out of because imagine the entire industry was paused. And what other industry could survive with no money, nothing coming in? And I don't know if you're aware, but there's only 2 areas of income for a cruise line, only 2. One is, and the same source, which is the guest. One, they buy the cabin, the cruise ticket, and the second is the onboard revenue.
True. That's it.
But it's the same source, the
Same
guest.
source, yeah.
So when you immobilize the guests and you lock them up in their house,
Zero.
your source is gone, and it was impossible to operate. And the year of restart was very difficult. Protocols, completely, a lot of them unnecessary, to be honest, totally unnecessary. And they were making them up as they went along. I tried to write the protocols for some countries in order to get a harmony. I created a system, but it was the health departments of each country that was taking over, and there was no plan. Some were copying some, and some were copying the others, and some were just making it up as they went along, I know there was good intentions there, but some terrible things happened during COVID. And I believe that more people died since COVID than actually of COVID. And that's another long story. And there are many, many factors, including the impact of the lockdowns, which is still having an impact today. People not getting cancer screened. And many countries are suffering, not only cruise lines, countries that spent so much money furloughing people and keeping the economy alive while locking people down and shutting down the economy, I'm proud to say that I lived in the UAE where that happened to a minimum, and especially Dubai. Dubai was a beacon of light during the COVID years. So 21, we restarted, and the complexity of the protocols was almost impossible to manage as a port agent. You have to, in some cruises you have to have multiple PCR tests.
Yeah.
But PCR test was created by a man called Kerry Mullis, and he said they should never be used for testing viruses. And he died before COVID, just before COVID actually, which is very interesting timing of his death. He wasn't there to say, hey, my test should not be used for viruses. So the PCR test now, you can see in the WHO,
It's not required.
the PCR test cannot tell the difference between COVID-19 and the flu, which says it all. So the complexity of buying, some countries and places charging 150 euros, which is one night on board for one PCR test, and maybe you need 3 or 4 on a cruise. On a very long cruise, you need more. It became impossible. And the poor cruise lines were trying to pay for all this, keep the company going, and still operate at a loss in 21. In 22 was a year of recovery.
Yep.
Not full recovery, just recovery. We started to recover.
Yeah.
At the beginning of the year, most itineraries lost money, but towards the end of the year and in the summer period for the Mediterranean, things started to ease, and restrictions started to go off. Leading countries like Greece, for Europe, Greece was the one.
Yeah.
Wonderful what the Greek government did. I used to consult the Greek government at one point for cruising, and I was very proud of how they opened up fast and led the way. So 22, the year of recovery. 23 was the year of full recovery. So we fully recovered at that stage. We got back to where we were in 2019.
And even more?
No.
No.
It was about a full recovery. Now you hear explosive growth, you hear all these phrases, but compared to 50% occupancy, which we had before, of course it's explosive, because we were half full before, so we cannot forget that. 2024 was a year of growth. We started to grow again, and we completed the cycle. But the year of getting out of debt has yet to come for some cruise lines.